From protecting your money to keeping you healthy, 2 Wants to Know is here to help you. Today, we're talking about how to reduce your risk of heart disease. Dr. Robert Krasowski with Cone Health Heartcare at Asheboro is here to talk all about what we should know to stay heart healthy. You know, you just had a new grandson on Easter. I'm sure you want to stick around for a long time to see him grow up. Why is being heart healthy so important to do that?
Well, still heart disease is #1 killer in United States. So I'm so happy to talk about that. Out of 5 people in United States will die because of heart problem. Even worse, in North Carolina, 1 out of 4 people will die because of heart disease. So it's still a huge problem. What are we doing wrong? Well, we don't exercise enough, we don't eat right, we still continue to smoke, we got diabetes, hypertension. All of this is bad news. Is there any good news? Yes, there is. 80 to 90% of heart disease can be prevented. Let me repeat this one more time. 80 to 90% of heart disease can be prevented. So let's talk about it.
That's a huge number that can be prevented. And one of the ways to do it is by screening. The American Heart Association just announced new guidelines encouraging cholesterol screening starting at the age of 30. How is that different than before?
That is correct. Those guidelines are updated every few years, and sometimes patients ask me why this thing continuously changing. Well, we simply learn new things. We have new research, new medications, so it did need to come to guidelines. Those new guidelines that were released last month actually stress importance of early recognition of the problem. We do realize that yes, when you're 50, 60, 70, 80 years old, you will have a heart problem, but problem really starts much earlier. We know that when people die, for example, in an accident, we look at the heart of 20, 30 years old people, they already have deposits of cholesterol in the heart. So new recommendation talks about checking cholesterol at age of 30. Then we evaluate you and trying to see what is your risk for having heart problem based on those numbers. And then we initiate therapy early, sometimes at age of 30. That's the newest recommendation compared to previously, which was 40 years old. So that's important.
Okay, you talked about therapy. What kinds of therapies are out there?
So there are a lot of therapies. Therapy doesn't necessarily mean medications, but we can start with diet and exercises. We do have a lot of medications that can lower cholesterol, and some of those medications, probably people heard about statin, but there are a lot of new medications that can be used, including some injectables. That sounds scary, but actually those medications are very effective and that really can prevent problems in the future.
Are you really putting 30-year-olds on some of these medications now?
Some of those people will get. So even more, we can, and we actually recommendation is to check cholesterol even if you are a child, especially if you have family history of premature heart problems. There are some congenital issue with high cholesterols that we start treating even much earlier. But yes, we may start putting people on medication when they're just 30 years old.
Well, thank you so much for being here. We're learning great information. Stick with us on the other side of this break. We've got even more ways to stay heart healthy.